Thank you, Paolo. My message is clear, and I will certainly echo what Paolo just said, that rare cancers are not rare. I would say that all cancers are going to be rare tumors because we are actually splitting what is called a frequent tumor, let's take an example, breast cancer, into different molecular subtypes which are becoming more and more narrow in terms of disease identification. So I really believe that what we are doing right now in terms of working on rare cancer is certainly extremely helpful to what is going to happen in the very near future to the so-called frequent tumor, which are going to be split in much less frequent entities. That was really an introduction for that, and I think it's important to state that. Indeed, I'm working within EORTC. I'm by definition a European person working in cancer. In rare cancer, it's very important that we work all together. And that's maybe important to remember that EORTC is indeed a European organization which works with all different types of organizations around the world. But within Europe, it brings together more than 300 institutions, thousands of researchers, put into clinical trials more than 3,000 patients per year. And that's an organization which has been started in '62. It was 48 years ago, and which has a central place in organizing the research we are able to do. It's not a unique place because it's more and more interacting with national groups from outside Europe, but it has certainly a long history and important expertise in this field. And one of the key work of EORTC in the last 10 or 20 years has been really to work on rare tumors. And I would quote only two examples. One is on brain tumor. One of the key trials which was enabled actually to improve significantly the outcome of patients with primary brain tumors was done within the EORTC, in the brain tumor group. That's a rare group of disease, and the trial brought together more than 500 patients. And the same is true for sarcoma, which is more my field. And we have to remember that the first trial which addressed the question of gastrointestinal stromal tumor with imatinib in Europe was done with EORTC. And while in '98 nobody was aware of the nature of mutation which were driving this tumor, in 2001 the EORTC had completed a trial of more than 900 patients in collaboration with the Italian sarcoma group and our colleagues from Australia. So this really shows that EORTC has a key role to develop and to organize and to facilitate clinical research in rare tumors. And this is really one of the strategic aspects we want to develop in EORTC. And this goes very much with what I said in the first minutes of my presentation, saying that all cancers are becoming rare tumors, because one of the key strategic plan of EORTC is to work more on translational research to characterize more and more precisely, more and more accurately, which are the subtypes of the disease we put into clinical trial. Our vision is that this is the way we are going to work in routine basis in 10 years from now, and that we should start to implement this process in clinical research right now. So characterize accurately, reliably, the molecular subtypes of the tumor in order to put into clinical trials homogeneous group of patients in order to be able to do clinical trials easily, internationally, at a European scale and beyond. And this points out, and that's the second part of the strategic plan, this points out to the need to develop targeted therapy, and it's quite clear that we can develop targeted therapy in cancer if we know well the target, if we know that the target plays a role in a given tumor subtype, and this is really the work we want to do. So EORTC is moving from the past history of clinical research on histological-based diagnosis and malignancy towards a moment where we are going to have as an inclusion criteria molecular criteria which will help us to develop clinical research. That's our goal, and that's a goal we are going to be able to achieve only by collaborating with patient advocacy group, with ESMO, with national groups, and I think with all groups around the world. Paolo was mentioning that we are together working in the sarcoma field, and one of the group on which we are trying to build since 1 year and a half now is a group which informally we call the World Sarcoma Network, which hopefully will be able to bring together researchers around the world and to do clinical trials which were not being possible in the past. Thank you very much.